Is the health care bill delivered to President Obama this evening?
The president is expected to sign it tomorrow, but since the vote in the House, nothing but questions.
All day we've been answering those questions, and tonight we're tackling another front, how your health care provider is reacting.
24-hour News 8's Mark Thompson digging into that aspect of the story. He joins us live right now at the live desk. Mark?
Yes, Susie, we spoke with hospitals, doctors, insurance companies, and patients tonight, and while they all say that they're waiting to see how things play out, they were able to offer some initial insight into how they think the future of health care will be affected by this bill, and many are excited about the possibilities, others not so much.
The rising costs.
A teacher by trade, Jackie Waring was laid off in January. She's 7 months pregnant, collecting unemployment, and was given 3 months insurance coverage from her old job. She decided COBRA coverage at $1,200 a month is too expensive. Her husband's company insurance said that her pregnancy may be considered a pre-existing condition. She also has a pacemaker for a heart problem that is a pre-existing condition. Waring says she's always found it odd that people with conditions that need insurance coverage the most can't get it.
Seems like it doesn't make sense, and so I hope that the bill will change that rule.
We spoke with officials at Blue Cross Blue Shield of Michigan. The nonprofit insurance company has always covered patients with pre-existing conditions and says requiring other insurance companies to do the same is a major step forward. And while many questions remain, they say the passage of reform requiring everyone to get health insurance will likely have a positive effect on the industry and patients.
If we get more young and healthy people who today have the option of going without medical coverage, if we get those folks into insurance coverage, that should soften rates for people who are older and less healthy, people who need health care services the most.
Dr. Frank Belcito runs a family practice for Metro Health. He agrees with covering more people in pre-existing conditions, but says this new health care reform may overwhelm an already stressed system. Yes, he says doctors will be able to provide more preventive care like screenings and blood work to more patients. But finding specialists willing to accept inferior coverage plans to treat what they find will be difficult.
I don't think this was done the right way with a lot of thought and process to do it correctly. I didn't understand the urgency, and I don't think that we fully understand what the cost of this is going to really be.
And we also got responses from Spectrum Health and St. Mary's Hospital's Spectrum CEO says that they're waiting on reconciliation of the bill before they comment any further. St. Mary's officials are also analyzing the bill, but they say that the move to provide health care coverage for the uninsured is a positive step forward for the health care system. Back to you.